Hey everyone. I am just letting everyone in and getting started. If you can hear me, let me know. You can type something in the comments or I can unmute everybody. I'll unmute you and you might be able to unmute yourself. Just let me know that you can hear me and that I sound okay.
I can hear you. You sound great.
Thank you. Okay, good. That's helpful.
Yep, hello.
Okay. So we have a lot of people joining this call, so I'm just going to give a few more minutes. I'm going to share my screen. So we can get started. I'm really happy to hang out with everyone today because we're all cat people.
Yeah. We all have vomiting cats, apparently.
We all have vomiting cats. It's so true. Okay. Let me try to share one more time. All right. Can you see my screen?
Yeah.
Okay, cool. For some reason I have to let everyone in one person at a time. I need to change some setting here. I think we almost have everybody in. And then let me put my camera on. Let me put myself in it. I just feel like my webcam is like so dark. Let's get some more light. Turn on all my desk lamps. How is everyone today on Tuesday?
Good.
Great.
Good. Let's see if I think I have everybody in.
Get out of there.
Okay, I'm trying to get one more person in and then we'll get started. I think there's about 20 of us on this call, so I'm going to keep everyone unmuted. You can mute yourself if something noisy is going on or if you don't want to be heard. No. Okay, so now that everyone's in, I would love to hear from you if you can put it in the chat or even say it out loud. How old is your kitty or kitties? Probably most of us have more than one cat.
The vomiting cat is 7.
7, okay. That is a young vomiting cat.
She's been vomiting for several years, too.
Okay. My vomiting cat is 13, and he started really vomiting about 3 or 4 years ago. Does anyone else want to share? 14, yeah, that's a really... 5, okay. 9, okay, we have some really young vomiting cats.
Can you hear me?
I can, yeah.
Oh, wonderful. Hi. I'm sorry about my car. I have myself on mute, but my cat's 19 going on, she might be 20, but
Nice.
she's been vomiting for the past 5 years, I suppose.
Okay.
I'll mute myself. Thanks.
Okay. Okay, we've got 13. My vomiting cat's 8, but she's been vomiting since I got her 3 years ago. 15 plus, 9. Yeah, so usually cats like start vomiting a little bit later. Most cats don't start vomiting as kittens, but there are a few cats here that are definitely vomiting at a pretty young age, at least compared to what I see in practice. I feel like my head is cut off here. Okay. So in this meeting, what I want to do is go over my approach. And there's the vomiting cat. It's really complicated, but I think there are a lot of places as a holistic vet that I have a unique perspective, and I want to share it with you. And because you are looking for more of an integrative approach, I think sometimes it's difficult to speak with veterinary internists or even just traditional veterinarians and really get your questions answered. So I'm going to just go through my approach. And the most important thing to know is that it's not normal for cats to vomit. And if this is the only thing that I can get across to anybody here today, which it sounds like most of you know that it's not normal for your cat to vomit. But for so long, so when I started vet school 16 years ago, we were just starting to shift and realize like, okay, cats shouldn't be vomiting once a week, but there are a lot of practitioners out there that will say like, oh yeah, cats vomit, that's what they do, it's normal. And really what we need to say, cats vomit commonly and it's not normal and something's wrong, and there are things that we can do to help them. So I'm glad that you all are here and you're realizing that your vomiting cat is not a normal cat, and there's something to be done. So spread the word, vomiting cats are not normal. So why do cats vomit? And I think this is really the most important question and the most important investigation into why your cat is vomiting. And when some cats will vomit every once in a while, just like dogs, maybe once a quarter or here and there. Maybe they'll go outside, eat a bunch of grass or plants, and then they come in and vomit. That's not what I'm talking about. Usually cats that have some kind of chronic problem are vomiting once a week, once every other week, 3 or 4 times a week, every day, multiple times a day. You see the whole spectrum. And so there are a lot of reasons for this. And inflammatory bowel disease is the most common, and we're going to get to that. But there are some easier reasons that we can address pretty quickly. Food allergy and sensitivity, that can happen. I don't see that uncommonly, and so it's worth addressing more like at the very beginning, and it can have a very quick resolution. So a lot of times just switching from, if you're feeding your cat a fish diet, feeding them a chicken or like a poultry-based diet can be enough, or maybe a beef diet. I feel like in my practice over the years, I've noticed like some cats are like fish cats and they just want fish. They like it. They do well. And other cats are poultry cats. And oftentimes I see cats that can't do one or the other. The second reason cats vomit is an inappropriate diet. So when I say inappropriate diet, I'd say like kibble, especially kibble that's made with a lot of corn and wheat, but just kibble in general can be pretty inflammatory for cats. The carbohydrate content of kibble is just too high. And so I've had a lot of success just getting cats off of kibble, and then the vomiting goes away. So usually I'll transition them to a canned diet or a raw diet if possible. Parasites is another reason why cats vomit. Now, luckily in Boulder, Colorado, I hardly ever see a cat with parasites. But it definitely can happen. In other parts of the country, especially if you have an indoor-outdoor cat, this is an area where you shouldn't let that go. So you should take a couple stool tests a couple weeks apart to your veterinarian just to make sure that there's not worms. And these are the most common worms we see in cats. But we would feel really silly. And I have to say, it's happened to me where you're like working up this case and doing all these diagnostics, and an internist will, do an endoscopy only to get the camera down there to find a worm. And it may or may not be the cause, but it's kind of silly to get that far without taking care of parasites. Let's see. So then inflammatory bowel disease, and we're going to spend a lot of time on inflammatory bowel disease because this is usually the most common reason. Hold on, I'm muting out, need to mute out a sound here.
My cat, I don't know if everyone can hear me. Can you hear me?
I can hear you, yes.
My cat is 5.5, and he's been vomiting for about 4 years. And he had an ultrasound for IBS and came back negative about 3 years ago. And 2 months ago, he started vomiting blood. Mm-hmm. And I brought him to an internal medicine specialist, and he was diagnosed with inflammatory bowel disease. But she suggested no raw diet because of the risk of salmonella.
Yes. Yeah. So with cats that have compromise, especially if you put them on steroids, it could
He's
be.
on steroids.
Yeah, he's on steroids. I shy away from raw diets if my cat is, or my patient's on steroids, although I've had a lot of cats in the practice that still eat raw diets, even on steroids. You just have to look at what kind of raw diet you're using, if that makes sense. Using if you're just going to the grocery store and getting raw meat, then there's a lot higher chance that you're going to have a salmonella contamination. If you're getting a high, if you're getting the HPP, the high pressure pasteurization, probably they're less likely. And then I think it's really important to understand that any diet you do, whether it comes from Hill Science Diet or Royal Canin or a natural food, they all have the potential to have salmonella.
Really?
Food get recalled all the time, and it's for salmonella.
I tried him on Stella and Chewy's.
Yeah.
And Instinct Raw, and he loves both, but the vet told me to take it away from him.
Okay. Both of those, I could be wrong about the Instinct. I'd have to check that out, but both of those are high pressure pasteurization. So it should be okay, depending on if you're leaving it out all day. But basically what they want to do is decrease the risk of vomiting and salmonella.
He's on steroids. He's severely asthmatic, which is why he started the steroids, but now he's continuing them daily for the IBD.
Oh, okay. Yeah. So he's on systemic steroids.
Yeah.
Yeah. And then we'll get to steroids later on down here in diet, but yes.
Okay.
Oh, let me not skip this slide. Okay. Another reason cats vomit are hairballs. And I get this a lot in my practice. And I think it's also important to understand, unless you have a long-haired cat.
I'm listening to a video. I can move.
Let me get them muted. Unless you are, parenting a long-haired cat. Let's see, hold on. Let's see if I can get them muted.
Why it's important to, when you're
For some reason, here we go.
Those are the negative ones. Or how you take that dough and really
Trying to figure out where this is coming, where this conversation is coming from. There we go. Okay. So it can be normal for long-haired cats as they're grooming. They could have hairballs. But usually if you have your cat on a biologically appropriate diet, like a canned diet or a raw food diet, your cat shouldn't have hairballs. But if you do, your cat does, brushing long-haired cats can be really helpful. And then adding fish oil and probiotics. So basically something happens with their digestion where they just can't groom themselves and digest healthfully. And so while you should do things to help it, you need to understand that it's not normal, and we do need to help them with their digestion. Okay, so what diagnostics should I do? And this is probably the most important part of the presentation, in my opinion, because this is where I think the communication between veterinarians and cat parents really break down, because it's not clear cut, and sometimes we don't get the answers we want. And so knowing what to expect ahead of time, if you have a vomiting cat, if you bring your cat to the veterinarian and start the diagnostic workup, this is what it's going to look like from start to finish. And these are the things that you want to make sure that you're looking for and your veterinarian's looking for. So first, we're going to look at blood work. And probably most of you have had some kind of blood work done on your cat. But just to be their medical advocate, basically what you're looking for and what veterinarians are looking for is kidney health, because kidney failure can cause vomiting in an upset stomach. And so you're going to be seeing that over here with the IDEX SDMA, if your veterinarian uses IDEX, creatinine, and BUN. In this particular panel, it's 100% normal, so we can feel good that this cat is not vomiting because of kidney disease. The next thing you want to look at are the electrolytes, and sometimes this gives us a clue of how much your cat is vomiting, because sometimes it's easy to miss it, and sometimes the sodium or potassium can be, and the chloride can be a little bit off. The other thing you want to look at is the albumin and total protein, because what happens over time when our cats are having intestinal inflammation is they stop absorbing protein from their diet, and so it will get low. It can also get low for other reasons, but these are the two things that you want to be looking at. Next up are liver enzymes. That's non-specific, but it is something to look at if your cat is vomiting. I don't want to overwhelm you with becoming a diagnostician, but I just want you to be able to advocate for your kitty and know what you're looking for. So complete blood count is the next thing that your veterinarian will probably look at the same time as the chemistries. And one thing that we're looking for here is the hematocrit. Like, is your cat anemic? Is there something else going on? Are we losing blood somewhere? And the white blood cells are going to tell us if there's a ton of inflammation, if something else could be going on. So it's less important, but I always like to have a complete blood count. Total T4, I would make sure that any vomiting cat has a total T4 done, because hyperthyroidism is really common in cats and it causes vomiting. And once we fix the hyperthyroidism, usually the vomiting goes away. So it's important enough that I would look at it, and I look at it every 6 months in cats that are beyond like 8 or 9. Usually this happens 10 or later, but you can catch it early and start treatment. So an abdominal ultrasound, and probably many of you have kitties that have had an abdominal ultrasound. Not all cats look as happy as this cat does with the ultrasound, but this helps to rule out things like tumors. It helps us look at kidney structure, and then it helps us look at the thickness of the intestines. And so this is a really like a non-invasive, although cats don't love it because they have to be on their back, just like this kitty here, but it's very non-invasive. All we have to do is shave and put this probe on their abdomen. The next thing you can do is a GI panel from Texas A&M University. Your veterinarian doesn't have to send it straight to Texas A&M. A lot of labs will send it there for them, but this gives us a few markers. So the first one is a TLI, and this measures that the pancreas is still working. It's really uncommon to have EPI in cats, but I've had a couple of patients over the years that have had chronic IBD with chronic pancreatitis, and eventually led to exocrine pancreatic insufficiency, which you don't have to worry about that. But basically it makes it hard for cats to digest their food, and it makes it hard for them to keep on weight. Cobalamin or vitamin B12 and folate. So these are just two vitamins, and we test the blood levels because then we can get an idea of how well the small intestine is absorbing. And that also gives us an idea if we have small intestine inflammation. And then pancreatic lipase or PLI, this looks at pancreatitis. And I'd have to say, in my experience, at least half the cats that have IBD also have some level of pancreatitis. And the pancreas is right next to the intestines. And so it's hard to know like who got inflamed first, but then sometimes the liver will join in. We call that triaditis. And so everything's just sitting next to each other, just getting inflamed. And so that's, those kitties can get really sick, and it can get pretty complicated, but you want to know what's going on there. And the most important diagnostic you can do is an endoscopy or a laparoscopy. So an endoscopy is where we go in with a camera, and so your cat's under anesthesia. We have them like swallow a camera. We go in here. I don't know if you can see my cursor, but we go past the stomach, and then we take little bites of the intestine and to send in to see what kind of inflammation we can do or we have. Even better, a laparoscopy, that does require for us to cut open, you have an incision in the abdomen and go in and take a full thickness biopsy. I find that most often we can get what we need with an endoscopy, but this helps differentiate cancer from just regular inflammatory bowel disease. And then it tells us how bad it is. And as a holistic vet, I really appreciate this test because then I can get an idea of, okay, what's the likelihood that more natural remedies are going to work in this case? And if it's, really severe, maybe we need to be doing steroids plus some natural stuff. I've also had a few cases where I was convinced it was going to be IBD and it was something actually completely different. I had one case that actually had a really deep-seated bacterial infection that just required antibiotics. And actually putting them on steroids, although we did it and it worked for a while, it wasn't advantageous. And the cat could actually get a lot better when we could put the kitty on antibiotics. So it can be really helpful to do this. One thing that comes up, and this usually comes up at the level of the ultrasound, is that this whole idea of IBD versus lymphoma. And I think the veterinary community just really scares everybody because we'll stick an ultrasound probe on your kitty and say, well, the bowel loops are thickened, so the intestines are thickened. It could be IBD or it could be lymphoma. And so we kind of just like drop that in, and it's really terrifying for people. And IBD can definitely turn into lymphoma. I haven't seen that happen a ton, but this is another good reason why it's helpful to get that endoscopy, because usually we can differentiate this. I know when my own cat had really severe weight loss, I was convinced he had lymphoma because he was vomiting all the time and he was so skinny. And it just turns out he had really bad IBD. He didn't have lymphoma. But just keep in mind, if this happens to you, that IBD is way more common than intestinal lymphoma in cats. Like chances are it's IBD. And I really encourage you to, if someone brings in the lymphoma, just to take a deep breath. And if you can afford the endoscopy, to do it and to get that diagnosis so you know going forward, because I feel like a lot of times what happens, this whole like lymphoma diagnosis just like looms in the background, and it's really anxiety producing for pet parents. Okay, so now we've gone through this really extensive diagnostic process. And if you've hung in with me here till here, or if you've done all this, then you can appreciate how complicated it was along the way. Because what happens is, while we see, we have some blood markers that make us think maybe we have some IBD, and the ultrasound looks like maybe we do. And then once we get to the endoscopy, we can get an idea of like, yeah, we probably do, or we for sure do. And so our treatment goals are, we want to maintain your cat's weight. And this is really important because as cats waste away, other parts of their health go, and we just want to support them. We want to decrease vomiting and diarrhea. If we can make it stop altogether, that would be great. We want to decrease intestinal inflammation, and we want to maintain vitamin B levels. I think this is forgotten a lot, that most of these cats aren't absorbing vitamin B, even if we haven't tested for it. I think it's important that we still add it in, and that's something that you can do at home. So when we talk about maintaining weight, I think it's important, especially for people like us that really want to do everything naturally, and we kind of have this holistic way of life, and it usually works for us. We might need to let go the idea of like a natural diet or what we think our cat should be eating, just because we need to get weight on. And it almost doesn't matter how we get it on. At this point, we just need to get it back on, and then we can tinker with it a little bit later. But some cats get so skinny and so emaciated that trying to keep everything natural all the time just is really not in their best interest. And I think sometimes our cats suffer because of our own ideology. So feed what doesn't worsen vomiting or diarrhea. And I'll tell you, with my own kitty, Simba, once I got the diagnosis, I thought, well, I'm a holistic vet. I can treat this holistically, even though his inflammation was quite severe. And I tinkered around with a lot of diets, and I watched him vomit more, and I finally went around to feeding him what he would eat, and then what worked, which wasn't my favorite, but it actually put weight back on him. And another thing that's important to do is weigh your kitty every 10 to 14 days if you're in the thick of it. Like if I don't weigh my cat Simba every 10 to 14 days, but if you're still trying to figure things out, keep weighing them. Because one thing that happened with Simba is that I actually, over time, didn't know how much weight he was losing because I was seeing him every day. With my patients, when I come and see them, come to their homes once a month, once every 6 months, I can, first of all, we weigh them, but I can appreciate it because I'm not seeing them every day. But when you see your cat every day, the weight can really get away from you. And so I encourage you to not let that happen. Let's see, I should have, I've lost a slide somewhere. Oh, here it is. Okay. So I like using a baby scale. You can get them on Amazon. If you get on Amazon, you'll see that there's lots of scales that are marketed towards pets, but I always feel like they're more expensive. Just get the baby scale. I also like the flat ones. You know, they make these little kind of tub ones so babies don't roll out of them, but I don't think cats like them as much. And I've had better success using this flat one. Okay. So what diets should you try? And I feel like I have every diet you could possibly try on this slide. But sometimes just switching to a canned diet from a kibble diet is all your kitty needs. And I would definitely switch proteins if you can. So if you're feeding chicken, feed a fish. Sometimes raw diets are really helpful. If you're getting to the point where you're thinking about using steroids, you might rethink a raw diet and get your cat in a place where they're absorbing more, and then you could revisit. Novel protein diets, basically, that just means that it's a diet that contains a meat that your cat shouldn't have seen before. Like you'll see, let's see, duck, although lots of cats are eating duck now, like duck and pea, venison, and Royal Canin makes several proteins, and they call, I think, Royal Canin Select Protein. Now, Royal Canin or feeding prescription diets in general is not my favorite, but I've had enough patients respond to this, and I was able to avoid steroids in these guys that I still try it out. And there is enough evidence that sometimes just switching to these proteins can be helpful. And the reason why I use the Royal Canin Select Protein is because I have a guarantee from them, for whatever that's worth, that there weren't other things on the conveyor belt. So there's not as much cross-contamination as if I were to go to a small pet food brand that's probably sharing their line with other foods. And there's nothing wrong with that. And they might be making great foods. But the whole idea behind the prescription diet is that there are no other trace proteins in there. And then a hydrolyzed diet is basically where they take the protein and they break it up into individual like strains, or like you think about protein, and I'll back way up. If you think about protein as a pearl necklace, and you have individual amino acids or pearls, what you can do to make the protein less allergenic is to cut it up. And so maybe they'll cut it up into like 3 or 4 pearls or 3 or 4 amino acids, and that's a hydrolyzed diet. Now, there is a Blue Buffalo is making prescription diets, and they do have a better ingredient deck. And I've actually had some pretty good success with their diets. And then Science Diet ZD is the other one that I've had some success with, although cats don't seem to like the taste of ZD as much as they like the Blue Buffalo. But if you're sitting here hanging out with me, you're looking at the ingredients, you're going to like the Blue Buffalo ingredients a little bit better than Royal Canin. The other diet you can try, and this is what ended up working for my kitty, was a GI diet. So basically any of these prescription foods will make a GI formula. And what they've done is they're playing around with the amount of fiber, protein, and fat, carbohydrates to make it just right to be as easily digestible as possible. My 2 favorite are the Royal Canin GI high calorie and high energy. That's what I feed my cat. And then Blue Buffalo makes a great GI food. My kitty didn't do as well on it, but I've seen a lot of kitties do great on it. And this is where I feel like I would rather have my kitty eating the blue buffalo, because when I look at the ingredient deck, I like it a little bit better, but he vomits on it. And so he doesn't vomit on the Royal Canin high energy. And I've been able to keep up his weight and maybe even make him just a touch fat. And so for me, that feels really good that I can keep up on that. If you can avoid any kibble of any of these brands, that is my preference. Some cats won't let you do that, and not everyone can control it. But if you can avoid the kibble, I would definitely do it.
Yep.
Okay, so our next goal is to decrease vomiting and diarrhea. So definitely diet is part of this. But a lot of cats are just so nauseous, and Cerenia can be really helpful. And I have a lot of people that email me around the country that are really nervous to use Cerenia. And I just want to let you know, like, this can be a game changer for your cat, and you might even be able to avoid steroids. And so anything that I can do to avoid steroids, I try to do. And if it makes your kitty feel better, you don't have to use it long-term. You can use it as needed. And so usually these come in these little blister cards, and you do a fourth a tablet. Usually it's pretty easy to give. Zofran is another drug that we use to help decrease nausea. I think Cerenia works a little bit better. Other veterinarians might disagree. And Zofran can have some side effects like constipation. Another thing that you could do is acupressure for your kitty, or acupuncture if you have a veterinarian that practices Chinese medicine or does acupuncture at all. But in the meantime, one point that you can use that you can stimulate yourself is stomach 36. I think this is really great for nausea. It's a master point for digestion in both cats and dogs. And so if you look at this kitty, I'm not sure if you can see my cursor, but right above this orange dot is the knee. And then right below that is the ankle. So cats are kind of more or less walking around on their fingers. And this is one place where if you just rub in a circular motion with your thumb or a forefinger, it's a really big point. So it's hard to miss it. You don't have to worry about getting it just right, but it can be really helpful for nausea if your cat will let you touch it. Some cats are really sensitive about their back end being touched.
Can you hear it? Can you hear me?
I can hear you. Yeah.
Oh, yeah. Is that the inside or outside of the leg?
That is the outside of the leg.
Got it.
Yeah. Okay.
Cool. Thank you.
So some other anti-inflammatories, like natural anti-inflammatories, things I try to do before I bring steroids on board is first to decrease carbohydrate content. I can't stress how important it is to get kitties off of kibble and to remove food allergens. That's another thing that I think veterinarians overlook. We want to move on to all of these, steroids or Cerenia and all these things, but we missed maybe that there's a food sensitivity. And I feel like we're not going to get very far as long as we haven't addressed that. Probiotics can be helpful. Fish oil is a great anti-inflammatory unless your cat is sensitive to fish, and then it's just inflammatory. So hemp RX, I use that a lot for cats with inflammatory bowel disease, and I see good results with that. So using CBD, a great anti-inflammatory, also helps kitties just overall feel better. If you've ever taken CBD, hopefully it works the same for you, but I take it every day and it just makes my thoughts a little bit happier. It makes me feel more relaxed. And I think our indoor kitties for sure could use more help with that. And there's a lot of herbs we can use, like licorice and marshmallow, and there's a ton of herbal formulas. What gets tricky is we have all these things, but I have very few cats in my practice that would take all of these at one time. If your cat is amenable to being pilled, then that opens up so much for you. Or if they will eat anything on their food, that can be helpful, but that's not most cats. And so usually I will prioritize really nailing down diet. Then I do probiotics. Then I'd probably do CBD and then fish oil if I can. Okay, so part 2 of decreasing inflammation are steroids and other medications. And sometimes we just have to use these. And unfortunately, I have seen some cats die without the benefit of steroids that can be life-saving for kitties. I don't think if I would have let my own kitty go, I don't think he would have made it too much longer. Cats can just get like waste away, and sometimes we need to use them. So budesonide is a great alternative to prednisone, and it's a steroid that stays more local to the GI tract. And so that's helpful, because when we think about giving cat prednisone every day, we worry about all of the side effects. Although I have lots of patients that have been on prednisone for years with no side effects. And then I've had other cats that have been on prednisone for a few weeks and became diabetic. And so there's not, the steroids are not without side effects. Prednisolone is just another form of prednisone. But I even my own cat is on prednisone because that's what works best for him. And then chlorambucil, I've seen this work quite well in a couple of patients where prednisone is not working. And I'm hoping that no one on this call is experiencing that, because when prednisone doesn't work, that feels like a really desperate place. But chlorambucil, even though it feels like a really big gun drug, can work quite wonderfully in cats and really help them restore health. Even though as a holistic vet, or, if you're holistically minded, you don't want to use drugs like that. But if things are so bad that steroids aren't helping, then I think it's definitely worth a try, and it can make your kitty feel a lot happier. So vitamin B12 injections, and then I'm going to get to questions. I know this has been kind of long today. This is really easy, and this is something that you can do unless your cat if you cannot handle your cat at all, then you probably can't. But most cats that, you can put on your lap, it's such a small needle. It's easy weekly subcutaneous injections, and you can just put it really anywhere in your kitty that you can get attentive fur. And it replaces the vitamins, the B vitamins that are not being absorbed in the intestines. Now, in this picture, this cat's getting a clear fluid injection, but vitamin B12 is actually bright red. And so you might see that if, your veterinarian gives it to you in needles to go home, it's bright red, and that's okay. And you really can't overdose it. That's another great thing. And so if you can do it at home, it can be quite helpful. Okay, so that's everything that I have. And I know there are a ton of questions. And I'm going to start with the questions that I see in the chat here. Okay, so Fancy writes, my cat will vomit wet food more than dry. I give her both, but she does better with her higher carb canned food. She also has blood in her stool, or more like on top of her stool. No parasites. Vet just said Pepsid and CBD, but it doesn't control it. If she goes too long without eating, she'll vomit dry food too. So this is where I would say that's really interesting that she vomits more on the wet. Makes me wonder if there's like a protein sensitivity, or if, let's see, no parasites. Okay. Hold on for just 1 minute here. Okay. It makes me wonder if there is a protein sensitivity, or if you've done the abdominal ultrasound or the endoscopy. I think those would both be really helpful. And then Annie writes, when you have time, could you say how much fish oil to add to our cat's diet? That's a really excellent question. So with fish oil, I always start, I usually use like Nordic Naturals or the RX vitamins. And then I will start small and then work up to the dose that is stated on the package. You can work past that dose, but usually once you're working past the dose, then you could be causing diarrhea. And so it's always best to start small and work up. It really depends on the cat, and it depends on what formulation you're using. Morgan writes, when trying other diets, is there anything to look out for when your cat has been prone to urinary crystals? Yes. So Morgan, one of the most important things you can do is never feed your cat dry food if possible. So feeding wet food is so important, because getting your cat water when they have a history of crystals can be just life-saving. I'd be interested to know if your cat's ever blocked, if your cat's male, or if, you know, you've ever had any significant problems with that. Oh, and then Eternity wants to know a CBD dosage. So I'm going to get one for your average 10-pound cat. So I usually start with half a mg per kg, but feel free in the chat to throw in a weight. So for a 10-pound cat, I would start with 2 to 3 milligrams twice a day. Amy writes, if a cat has a chicken sensitivity, would it be helpful to eat a hydrolyzed protein or prescription GI specific canned food that includes chicken? The hydrolyzed chicken, yes. But if there's chicken that's not hydrolyzed, I don't think that would not be helpful. Valerie writes, hey Valerie, how's it going? Oh, let's see. If you do not use steroids, do you risk the IBD causing lymphoma in the long term? How long can you safely use steroids? That's an excellent question. I would imagine, so we know that chronic inflammation leads to cancer over time, or at least it can. I don't know if we have any studies to look at untreated cases of IBD and if they more quickly turn to lymphoma without prednisone or steroids. But that, I think hypothetically you could make the case, but I don't know if that's true in reality. And how long can you safely use steroids? You can use them for years. Budesonide is the best because it stays more locally, and so we don't worry about diabetes as much. But I have a lot of cats in my practice that are on prednisone without developing diabetes. And then Peter writes, would the AMG Eye Test show the bacterial overgrowth? No. That is one thing that is up and coming in veterinary medicine as to how we can best optimize the bacterial balance, or what is the best bacterial balance too, is the biggest question in cats and dogs. Texas A&M does have a test that will show dysbiosis, but then we don't really know what to do with it. So you could do that, and then it depends on what you do with it. Fecal transplants are something that are like up and coming that I think might play a huge role for cats with IBD. And then Sammy writes, Serenia works beautifully for both my feline and canine. And then I think, Sammy, it looks like it got cut off because then it says, how can FIV? But I'm glad that that the Serenia is working. And then Liz writes, what type of probiotic and how much do you suggest? I usually overall rotate between soil-borne and non-soil-borne. And so the Bacillus coagulans that we have, that's what we sell in our store. I really like that. You could do a fourth of a capsule starting once a day and work up to twice a day. And then the RX Biotic is another one I really like. That's a non-soil based. So I'll go through a bottle of the soil based, and then I go through a bottle of the non-soil based, and I just kind of rotate through there. Valerie writes again, my cat is on a raw diet. My vet has diagnosed her with IBD, but she's not had an endoscopy. She tends to cough up major fur balls when she's vomiting a lot. Her poop is very dry and very shriveled up. Her weight is good. She's on CBD oil, but when I try to wean her off steroids, she tends to increase her vomiting. But even on steroids 2 to 3 times a week, she will throw up a couple times a month on average. Okay. I wonder if you started giving her steroids every day in a smaller dose. And then Sharona writes, in lieu of fish oil supplements, I've been giving them sardines. Would you consider that sufficient? Yeah, I think sardines are great. You might not be getting the same number of omegas, but I always have to wonder if it's more bioavailable and the real deal. And then Sammy writes, how does FIV play into IBD? You know, I don't know if we have enough research to know exactly how those two work together. I think the tricky part about FIV is that we don't want to, so FIV, for everyone that doesn't know, is just a virus that suppresses the immune system. That gets tricky because we want to use steroids, but then we can't. And so, or we can, but we just have more risk involved. And then Amy, hey Amy, can cat owners order a GI workup test from Texas A&M. No, that has to be done by a veterinarian. But I bet your veterinarian might not know about their test for dysbiosis. I didn't know about it until, I don't know, maybe like a year ago. And I went to school there. So it's a new test too. And so you might just bring it to your vet's attention. They might not know.
Quick question on that.
Yeah.
Dysbiosis. If they just had like 6 milliliter drawn, is it possible they still have enough serum, or is it probably have to take another draw?
Oh man, that's a lot. They should have some. And did they?
I know.
Yeah.
They ton. And they did just the usual 4 tests at A&M, not the dysbiosis.
Oh, so for the dysbiosis, I think they would use poop.
Oh, okay.
Yeah. Yeah.
Thank you.
So Lindy writes, got in late. Did you speak of the white foam throw-ups and gastritis? Have changed diet, very few treats, small meals about 6 times a day, some hemp oil in at times, and she's doing much better. She's borderline hyperthyroid. So that's tricky because hyperthyroidism causes vomiting. And so that is tricky. Probably getting an ultrasound or maybe an endoscopy to see what's going on in her stomach. And then Lynn writes, do you have an opinion about animal biome? And Amy, we were talking about this last week. So I checked into Animal Biome, and they will do a test where they look for like the types of bacteria that are present. But then the tricky part is we don't really know what to do with that information. And so they do sell fecal transplant kits, which I think is really cool. I'm not sure how they screen their donors. And that's the really hard part about fecal transplants right now, is that we don't know who's the best donor because we actually just don't know what the best microbiome should look like, or the best balance of bacteria. But I think, they're definitely up and coming. I haven't heard of anyone doing it and having success. I've done some fecal transplants with mixed successes. But yeah, I'm glad that people are out there and doing it, because I feel like we're just going to have to do it. So Eternity writes, the difference between white foam vomit and food vomit. My kitty has both. I think it's just whether or not there's food in your kitty's stomach or not. That's the difference between the foam and the not.
What's previous? Is it the old or something?
Okay. And then what do you think of using slippery elm in cats with hairball issues? I think slippery elm is great. If your cat,
take this with you. I have to work.
In your cat, then I think it's definitely worth doing. It's very safe to use. All right. Okay. I think I got through all the chat questions. Other thing you can do if you want, I can bring you on. You can raise your hand on this. There's a lot of people in here, so I can't necessarily see everyone at a time, but you can raise your hand, or you can put more in the chat. You are welcome, Lynn.
I have a question.
Yeah.
Was there anyone else, or should I go ahead?
I think you should go ahead. I don't see anybody else.
Okay. There was a couple. Well, what's the best way to investigate the bacterial? Because I kind of suspect that we did the GI test, but as you say, that doesn't answer that question. So is that dysbiosis test the best way? And or could you just do a course of antibiotics, or is that not a good practice?
You definitely I don't think it's a bad practice. Sometimes stuff gets just better with a course of antibiotics. You could try a course of antibiotics. The other thing that you could do is just do a gut healing protocol where you remove allergens and you do things to help, support the gut. Like if your cat can have broth, doing all like the bone broth and glutamine and all those kind of supplements, and then putting as much good bacteria in there. And I feel like with cats, one of the best fermented foods is fish stock. If your cat can do fish.
Oh, yeah, they love fish.
They do? Okay, great. Yeah. So the fermented fish stock, it smells so gross, but if you can do it, that's a great source of bacteria.
Where do you get that? Where do you get fermented?
So where do you live?
I use the grocery store. I'm in South Carolina.
I wonder if you could just get it at a health food market. Do you have,
Maybe.
yeah, maybe you have like Whole Foods.
Yeah. Okay, fermented fish stock. And should I wait to see if the other questions? Because I had a follow up.
Yeah, go ahead.
She's down to, in the last month, she's lost another pound, and we're doing the B12.
Mm-hmm.
But my vet's really reticent to start the steroids, but I'm sort of feeling like maybe it's time, because she usually was 11 pounds her whole life,
Mm-hmm.
and like 10 in 2017, and then 9 in 2018. So at what point do you decide to do the
Is she vomiting a lot?
She's not, but she's doing almost every day a quarter tablet of Serenia. So
if you took her off the Serenia, would she vomit every day?
Probably, yeah.
Then I mean, I think I don't think there's a problem with starting. And the only reason I would say to hold off is if you think you're going to do the endoscopy. Because once you start doing steroids, it can muddy the waters a little bit, not always. Yeah.
Okay. So it'd be better to do that first.
If you can. And sometimes you just can't. And then you can start them. Yeah.
Okay. Thank you.
You're welcome. Okay. There are a few more coming in from the chat. Okay. So Valerie writes, are you aware of the supplement Thrive for cats? And do you have an opinion? I'm not aware of that. Amy writes, can a regular vet check vitamin B levels to see if vitamin B12 supplementation is warranted? Yes. So that's the Texas A&M panel, although any lab that your vet uses, Antech or IDEX, will also do that. I don't know if everyone sends them to Texas A&M anyways, or if they do it in-house, but yes, that's really common in mainstream. Sammy writes, my cat with FIV was given budesonide. She began vomiting immediately after I administered it. I ceased giving it to her. I was not aware that cats with FIV can't take steroids. So Sammy, they can. It's just that it's not ideal. We try not to suppress their immune system anymore. So that's probably why your vet started with budesonide. It'd be interesting to know if what the budesonide in was causing the vomiting, or if it was the budesonide, or if it was unrelated. Does anyone else have any questions?
I do. I don't know if you can hear me.
I can hear you.
Does Royal Canin Select Proteins GI high protein diet come in canned and dry?
Yes.
Okay.
Yes.
And I assume that's a prescription diet?
It is a prescription diet.
Okay. And what was the first medication that you mentioned that was an alternative to steroids?
Oh, using Serenia. Let's see here. Would it help if I went back on the slide? Let's see if I can go back.
I thought it began with a D.
Was it this slide? Let's see. I don't think we talked about medications before. No.
My cat has been on prednisone for a long time, every day.
Okay.
For both IBD and asthma, but I'm concerned about the long-term effects of steroids.
Yeah, so what you could do is switch your cat to budesonide. And then, I don't know if your kitty would let you, but you can get inhalant steroids, fluticasone, and they make these little masks for cats. I don't know if your vet's offered you that.
I have it, except giving it to him, he won't sit still long enough to take enough breaths. Mm-hmm. So I have to use that with the liquid prednisone because the inhaler is not enough.
Oh, okay. Yeah.
Yeah, he fights me, so it's not enough.
Mm-hmm. Mm-hmm. Yeah, then that's hard because then you want to keep that prednisone on so he can keep breathing.
Yeah.
Yeah, but the other thing you could try with the asthma is CBD. I've seen really good results with that. Have you tried CBD for the asthma?
I've been really reluctant to try it, and my vet is against it. He's going to an internal medicine specialist now because he has so many issues, and she's reluctant for me to try it because he's on so much medication. He's also on omeprazole for acid reflux and Serenia for vomiting.
Mm-hmm. Yeah.
And he's on terbutaline twice a day.
I've had really great success with it. But yeah, I mean,
CBD.
you want to do it, like, you want to feel comfortable with what you're doing. I haven't really seen it. I have interactions with other medications, but I mean, I definitely want you to feel good about it. But that would be another thing that I've seen. That, and actually, I don't know if you have a Chinese medicine practitioner, but sometimes I can decrease steroids with asthmatic cats with herbs, because right now it's not the IBD keeping your cat on like systemic steroids, it's the asthma. And so if like we could somehow get the asthma under control another way than systemic steroids, that would be great. And then you could get, on the budesonide and switch over. How long has your cat been on prednisone or prednisolone?
He's been on prednisolone for about 3 years for his asthma, and the vet wants him to stay on it now because of his IBD diagnosis. He had an endoscopy done.
Okay.
He was actually vomiting blood, and she said his intestinal walls are thin and they tend to bleed easily. So he's probably had IBD for a while, and I just didn't know.
Yeah, that's really common. So many cats have IBD. Yeah.
I'm trying him on the Blue Buffalo diets now. He did not like the hydrolyzed protein, and this week I'm trying him on the novel protein alligator.
Okay. Yeah.
He's not a big fan, so I don't have a whole lot of options.
Yeah, I know. I think the alligator is kind of gamey and lean. I think some cats really like it, but I definitely seen that where it's just not as tasty as other meats.
Yeah, I'm going to ask about the Royal Canin Select Proteins the next time he goes.
Yeah, give that a try. Sometimes you just have to try a lot of diets.
What is the dysbiosis test?
So that's it. Texas A&M has a dysbiosis test where you can look to see if there is, like, you're sending stool. The tricky part is knowing what to do with it. So if you got it back and it said, yes, your cat has dysbiosis, that's where I think that's where like Western medicine gets a little bit tricky, because they don't have, although, there really are, I mean, most veterinarians are like using probiotics, at least, like we recognize that dysbiosis is happening, but then what to do about it gets a little bit tricky. And
he's on the Visbiome.
Okay. Is that a probiotic?
Yeah, it's refrigerated. It comes in a pill, a capsule. And I open the capsule and dissolve it in water and give it to him in a syringe.
Okay. Yeah. And you could always try alternating with other probiotic strains or blends too. Because the more we can get in there, the better. Yeah.
The vet told me not to give him other probiotics while he's on the Visbiome.
Oh, interesting. I wonder why not.
I don't know why.
Usually the more bacteria, the better. For some cats, although there are exceptions to that rule, for sure. And you could always, go through a bottle of that and then do a bottle of something else as well. Okay, I see another.
Thank you.
Oh, you're welcome. Okay. So Amy writes, okay, will you be sending out a recording of this live chat? I will. I finally figured out how to do that now. Let's see. And then Valerie writes, Flower eats only chicken, pretty much. Other protein she tries tends to throw up, like rabbit. These are raw. If I were to try to get a diagnosis, what would I try? Using prescription diets definitely goes against my beliefs. I understand that. I really do. But I want her to be healthy. Yes. Those highly processed diets seem to me that they would fix a problem while perhaps causing other issues later. But what if she's allergic to chicken, but that is all she accepts to eat? I mean, I think there's two parts to that question. It is true, like, when we look at these prescription diets, it does feel really counterintuitive to use them, but if that's what works, as long as you stick to the canned diet, I don't worry too much about long-term effects. I honestly think feeding Royal Canin canned of any variety is going to be 1,000,000 times better than feeding a kibble that is even grain-free and holistic or natural, organic, or all of those things. Because of the carbohydrate content of the kibble, I think you'd still be better off feeding the canned. And then if she's allergic to chicken and that's all she'll eat, then you have to feed her chicken. And I think that's where she's probably going to make some of her own life choices. And that gets a little bit tricky. Because with cats, you just can't starve them out. Like they're always going to win.
When you say remove allergens, is that related? What do you mean?
So remove things they're allergic to, like doing some investigation about, trying different proteins, like fish versus poultry, or even chicken versus turkey, doing some investigation. Right. Yeah.
Okay.
And then Lisa writes, oh, go ahead.
Do you like the Royal Canin digest sensitive canned food?
For cats?
Yeah.
I have not used that one. So I have the GI, I've used the GI ones, and I generally use the GI high energy just to get as many calories in, but I haven't used the other ones, but they might be quite helpful. Lisa writes, my cat vomits sometimes immediately after eating. We feed small amounts multiple times a day, and the vomiting seems to happen when she first eats a meal after not having eaten a meal for several hours. So like sometimes first meal in the morning and then first meal when we get home from work. We try Nux Vomica and Phosphorus, which are both homeopathics, and they seem to help, but we're not sure exactly how to use them. Once a week, once a month, once after vomiting. Any tips? Okay, so as far as the homeopathic, so I have a very basic knowledge of homeopathy. And so I'm definitely not the best person to ask about that. The classical homeopaths would say use them like 1, 2, or 3 days and then never again. But I don't know if that's like really practical. And then it sounds like the vomiting is what we call bilious vomiting. And I wonder if we could feed her more frequently. And I know you have to go away to work, and maybe putting some food on a feeder so that she doesn't go all night or all day. I would try that first. All right, I have time to take one more question. Does anyone else have one more, or maybe we're out anyways?
I've got one, but
okay,
just on CBD. CBD, because I was really hoping that would kind of resolve things, and I didn't know which one to pick. I picked a liquid, and I can't. Anyway, I think she got like worse blood in her stool as a result. So I was bummed and kind of crossed that off the list. But now you've had good results. Do you think a powder is okay? And what's your favorite brand?
Yeah, so my favorite brand's HempRx. A powder would just be a distillate, so it would just be CBD. That would be very interesting to try, because I think cats
from a capsule, Yeah.
Oh yeah. Cats that get worse on CBD, which that does happen every once in a while. I think they're just allergic to the plant. So what we're doing, and so the CBD distillate would be really interesting, because they'll just take CBD out and it makes this white powder. Now they're even making it they're getting CBD from citrus now too, to try to get around all the hemp laws. But I think that could be really interesting to try just CBD.
It's called a distillate.
Yeah.
So maybe I can get that. Okay.
And it's a lot less expensive, so that's also a bonus.
Oh, really?
Yeah.
Just called CBD distillate.
Yep.
Okay, thank you.
Yeah. Well, thank you everyone for coming. And if you have any other questions, feel free to email me. And I think next week we're talking about preventing cancer. So hopefully I can see you next week. And I hope you all have a great day.
Thank you so much.
You're welcome.
So very much. Yeah.
You're welcome.